When teaching a patient about the negative feedback response to stress, the nurse includes which of the following to describe the benefits of this stress response? 1. Results in neurophysiological response. 2. Reduces body temperature. 3. Causes a person to be hypervigilant. 4. Reduces level of consciousness to conserve energy. Answer. 1. Results in neurophysiological response. Rational. Negative feedback senses an abnormal state such as lower body temperature and makes an adaptive response such as shivering to generate body heat to return the body to hormonal homeostasis. A woman who was sexually assaulted a month ago presents to the emergency department with complaints of recurrent nightmares, fear of going to sleep, repeated vivid memories of the sexual assault, and inability to feel much emotion. The nurse recognizes the signs and symptoms of which medical problem? A. General adaptation syndrome. B. Post-traumatic stress disorder. C. Developmental crisis. D. Alarm reaction. Answer. B. Post-traumatic stress disorder. Rational. Post-traumatic stress disorder is characterized by vivid recollections of the traumatic event and emotional numbing, and often is accompanied by nightmares. General adaptation syndrome is the expected reaction to a major stressor. Developmental crisis occurs as a person moves through life stages rather than in response to a trauma. Alarm reaction involves physiological events such as increased activation of the sympathetic nervous system that would have occurred at the time of the sexual assault. While giving a lecture on attention deficit hyperactivity disorder, the nurse encourages which of the following to reduce children's stress regarding homework assignments? A. Time management skills. B. Prevention of iron deficiency anemia. C. Routine preventative health visits. D. Speech articulation skills. Answer. A. Time management skills. Rational time management skills are most related to homework assignment completion. Anemia prevention will improve energy levels but not stress. Routine health visits are important but do not directly affect ability to complete homework. Speech and other developmental aspects need to be developed if the child is to be successful. But skill development will not directly reduce homework-related stress. Identify a socio-cultural factor that can lead to developmental problems. A. Family relocation. B. Childhood obesity. C. Prolonged poverty. D. Loss of stamina. Answer. C. Prolonged poverty. Rational, environmental, and social stressors are believed to lead to developmental problems. Socio-cultural refers to societal or cultural factors. Poverty is a socio-cultural factor. Stamina loss and obesity are health problems, and family relocation is a situational factor. The purpose of unconscious ego defense mechanisms is to do which of the following for the individual? A. Protect against feelings of worthlessness and anxiety. B. Facilitate the use of problem-focused coping. C. Evaluate an event for its personal meaning. D. Trigger the stress control functions of the medulla oblongata. Answer. Protect against feelings of worthlessness and anxiety. Rational ego defense mechanisms offer the individual psychological protection from emotional stress. They are used unconsciously to protect against worthlessness and feelings of anxiety. Problem-focused coping is a coping strategy rather than an ego defense mechanism. Evaluation of an event for its personal meaning is primary appraisal. The medulla oblongata controls heart rate, blood pressure, and respirations and is not triggered by ego defense mechanisms. An adult who was in a motor vehicle accident is brought into the emergency department by paramedics who report the following in transit vital signs: oral temperature, 99.0 F pulse, 102 beats per minute respiratory rate, 26 breaths per minute blood pressure, 140, 106. The nurse can identify that which hormones are the likely causes of the abnormal vital signs. A. ADH and ACTH. B. ACTH and epinephrine. C. ADH and norepinephrine. D. Epinephrine and norepinephrine. Answer: D. Epinephrine and norepinephrine. Rational epinephrine and norepinephrine are catecholamine hormones secreted by the adrenal medulla that rapidly elevate heart rate and blood pressure. ACTH originates from the anterior pituitary gland and stimulates cortisol release. ADH originates from the posterior pituitary and increases renal reabsorption of water. The nursing student gave a wellness lecture on the importance of accurate assessment and intervention from a personal, family, and community perspective. The other nursing students enjoyed the lecture about which nursing theory? A. Ego defense model. B. Situational model. C. Evidence-based practice model. D. Newman systems model. Answer: D. Newman systems model. Rational. The Newman systems model is based on an individual's, family, community's relationship to stress and the reaction to stress. This model promotes wellness on primary, secondary, and tertiary levels. The other item listed as models are not nursing theories. Ego defense mechanisms are unconscious coping mechanisms. Situation refers to factors such as relocation or family job changes that are stressors. Evidence-based practice consists of relying on data or other reputable information sources to guide nursing care. The nurse teaches stress reduction and relaxation training to a health education group of patients after cardiac bypass surgery. The nurse is performing which level of intervention? A. Primary. B. Secondary. C. Tertiary. D. Quad level. Answer: C. Tertiary. Rational tertiary level interventions have the purpose of assisting the patient in readapting to life with an illness. Tertiary prevention focuses on the person who already has the disease and is recovering or rehabilitating. Tertiary prevention goals are to slow down the disease process, prevent further damage or pain from the disease, and prevent the current disease from creating other health problems. Primary level consists of stress prevention, promotion of wellness, and risk factor reduction before illness occurs. Secondary level occurs after symptoms appear and assists the person to develop resources to manage illness and stress. Quad level does not exist. A nurse is teaching guided imagery to a prenatal class. Identify an example of guided imagery from the options below. A. Singing. B. Back massage. C. Sensory peaceful words. D. Listening to music. Answer: C. Sensory peaceful words. Rational guided imagery is used as a means to create a relaxed state through the person's imagination, often using sensory words. Imagination allows the person to create a soothing and peaceful environment. Singing, back massage, and listening to music are other types of stress management techniques. After a natural disaster occurred, an emergency worker referred a family for crisis intervention services. One family member refused to attend the services, stating, "No way, I'm not crazy." The best response the nurse can give is which of the following? A. Many times disasters can create mental health problems, so you really should participate with your family. B. Crisis intervention is a short-term problem-solving type of help, and seeking this help does not mean that you have a mental illness. C. Don't worry now. The psychiatrists are well trained to help. D. Crisis intervention will help your family communicate better. Answer: B. Crisis intervention is a short-term problem-solving type of help, and seeking this help does not mean that you have a mental illness. Rational. Crisis intervention is a type of brief therapy that is more directive than typical psychotherapy or counseling. It focuses on problem-solving and involves only the problem created by the crisis. The goal of crisis intervention is to create stability for the person involved in the crisis while promoting self-reliance. The other options do not properly reassure the patient and build trust. Pediatric stressors related to self-esteem and changes in family structure reflect which maturational school age category? A. Elementary school age. B. Pre-adolescence. C. Adolescence. D. Early adulthood. Answer B. Pre-adolescence. Rational. The pre-adolescent age category experiences stress related to self-esteem issues, changing family structure due to divorce or death of a parent, or hospitalization. Adolescent stressors include identity issues with peer groups and separation from parents. Elementary school age stressors include friends, family, and school relations. Adult stressors centralize around life events. A nurse observes that a patient whose home life is chaotic with intermittent homelessness, a child with spina bifida, and an abusive spouse appears to be experiencing an allostatic load. As a result, the nurse expects to detect which of the following while assessing the patient? 1. Post-traumatic stress disorder. 2. Rising hormone levels. 3. Chronic illness. 4. Return of vital signs to normal. Answer 3. Chronic illness. Rational. An increased allopathic load can result in long-term physiological problems and chronic illness. Post-traumatic stress disorder results from a single traumatic event. Hormone levels rise in the alarm stage. Vital signs return to normal in the resistance stage. A trauma survivor is requesting sleep medication because of bad dreams. Concerned about post-traumatic stress disorder, the nurse asks, A. Are you reliving your trauma? B. Are you having chest pain? C. Can you describe your phobias? D. Can you tell me when you wake up? Answer A. Are you reliving your trauma? Rational people who have PTSD often have flashbacks, re-experiencing the trauma. The other answers involve assessment of problems not specific to. A teen with celiac disease continues to eat food she knows will make her ill several hours after ingestion. Given appropriate tertiary level interventions, the nursing intervention would be to A. Teach the patient about the food pyramid. B. Administer antidiarrheal medications with meals. C. Assist the teen in meeting dietary restrictions while eating foods similar to those eaten by her friends. D. Admonish the teen and her parents regarding her consistently poor diet choices. Answer C. Assist the teen in meeting dietary restrictions while eating foods similar to those eaten by her friends. Rational. Tertiary level interventions have the purpose of assisting the patient in readapting to life with an illness. By adjusting the diet to meet dietary guidelines and also addressing adolescent emotional needs, the nurse will help the teen to eat an appropriate diet without health complications and see herself as typical and normal teenager. Teaching about the food pyramid will not address the real issue, which is that the teen is still eating what she knows will make her ill. Administering antidiarrheal medications may help but is not tertiary level intervention. Admonishing the teen and parents is not a tertiary level intervention. And because this approach is not therapeutic, it may cause communications problems. Despite working in a highly stressful nursing unit and accepting additional shifts, a new nursing graduate has a strategy to prevent burnout. The best strategy would be for the new nurse to A. Identify limits and scope of work responsibilities. B. Write for 10 minutes in a journal every day. C. Use progressive muscle relaxation. D. Delegate complex nursing tasks to licensed professional nurses. Answer A. Identify limits and scope of work responsibilities. Rational, an important step in preventing burnout is acknowledging one's own limitations, as well as what one's scope of work is while on the job. By doing this, the person will help to prevent emotional exhaustion and will limit the effects of chronic stress. Journaling and muscle relaxation are good stress-relieving techniques but are not directed at the cause of the workplace stress. Delegating, if not applicable, is an inappropriate coping mechanism. A senior college student contacts the college health clinic about a freshman student living on the same dormitory floor. The senior student reports that the freshman is crying and is not adjusting to college life. The clinic nurse recognizes this as a combination of situational and maturational stress factors. The best comment to the senior student would be A. I'd better call 911 because your friend is suicidal. B. Give her this list of university and community resources. C. You must make an appointment for the student to obtain medications. D. I'd recommend you help the student pack her bags to go home. Answer B. Give her this list of university and community resources. Rational, a health care provider can help to reduce situational stress factors for individuals. Providing the student with a list of resources is one way to begin this process as part of secondary prevention strategies. This is not a medical or psychiatric emergency, so calling 911 is not necessary. No, everyone who has sadness needs medications. Some need counseling only. Not enough information is given to know whether the student would be best suited to leave college. An adult male reports new onset seizure-like activity. An Egan and neurology consultants report rule out a seizure disorder. When considering the ego defense mechanism of conversion, the nurse's next best action would be to A. Recommend acupuncture. B. Confront a patient on malingering. C. Obtain history of any recent life stressors. D. Recommend a regular exercise program. Answer C. Obtain history of any recent life stressors. Rational, the purpose of an ego defense mechanism is to help regulate emotional stress. By regulating emotional stress, the individual gains some protection from anxiety and stress. A conversion reaction involves repressing an anxiety-producing conflict and transforming it into a non-organic symptom such as difficulty sleeping, appetite loss, or sudden blindness without medical cause. The nurse must assess the patient fully before implementing any nursing interventions. Although the patient may be malingering, confrontation is not therapeutic because the patient is using this type of defense mechanism in response to some type of stressor. During the evaluation stage of the critical thinking model applied to a patient coping with stress, the nurse will select nursing interventions to promote the patient's adaptation to stress. B. Establish short-term and long-term goals with the patient experiencing stress. C. Identify stress management interventions for achieving expected outcomes. D. Reassess patient's stress-related symptoms and compare with expected outcomes. Answer D. Reassess patient's stress-related symptoms and compare with expected outcomes. Rational, during the evaluation stage, the nurse compares current stress-related symptoms against established measurable outcomes to evaluate the effectiveness of the intervention. Selecting appropriate interventions and establishing goals are part of the planning process. A patient who is having difficulty managing his diabetes mellitus responds to the news that his hemoglobin A1C, a measure of blood sugar control over the past 90 days, has increased by saying, "The hemoglobin A1C is wrong. My blood sugar levels have been excellent for the last 6 months." The patient is using the defense mechanism 1. Denial 2, conversion 3, dissociation 4, displacement. Answer 1. Denial rational. Denial is avoiding emotional stress by refusing to consciously acknowledge anything that causes intolerable anxiety. This patient's statements reflect denial about poorly controlled blood sugars. A young adult's chief complaint is seizure fits. A chart review shows a negative EEG report and a normal neurological consultation report. A psychosocial history reveals increased family stress, bankruptcy, and a recent divorce. The nurse recognizes that this young man's pseudo-seizures most likely are an example of which unconscious coping mechanism. 8. Compensation. B. Conversion. C. Dissociation. D. Denial. Answer B. Conversion rational. A conversion reaction is an ego defense mechanism that involves repressing an anxiety-producing conflict and transforming it into a non-organic symptom such as difficulty sleeping, loss of appetite, or sudden blindness without medical cause. Compensation is making up for a deficiency in one aspect of self-image by strongly emphasizing a feature considered an asset. Dissociation involves experiencing a subjective sense of numbing and a reduced awareness of one's surroundings. Denial is seen as avoiding emotional conflicts by refusing to consciously acknowledge anything that causes intolerable emotional pain. A person stages that he was not shoplifting from the store despite very clear evidence on the store surveillance tape. This person is demonstrating which ego defense mechanism? A. Dissociation. B. Conversion. C. Denial. D. Compensation. Answer C. Denial. Rational denial consists of avoiding emotional conflicts by refusing to consciously acknowledge anything that causes intolerable emotional pain. Dissociation involves creating subjective numbness and less awareness of surroundings. Conversion involves repressing anxiety and manifesting it into a physiological problem. Compensation occurs when an individual makes up for a deficit by strongly emphasizing another feature. An assessment finding example for caregiver strain would be which of the following? A. Caregiver routinely creates a weekly menu plan. B. Caregiver has not received medical care when ill. C. Caregiver can identify respite care provider. D. Caregiver attends religious service. Answer B. Caregiver has not received medical care when ill. Rational. A nurse will identify a caregiver's lack of self-care as a potential example of caregiver role strain. Sacrificing their own health to care for the identified patient places caregivers at risk for becoming ill themselves. If caregivers jeopardize their own health, they may not be able to care for the actual patient. In all of the other options, the caregiver is handling caregiver stress appropriately. When doing an assessment of a young woman who was in an automobile accident 6 months before, the nurse learns that the woman has vivid images of the crash whenever she hears a loud, sudden noise. The nurse recognizes this as blank. Answer: post-traumatic stress disorder, PTSD. Rational. PTSD originates with a person's experiencing or witnessing a traumatic event and responding with intense fear or helplessness. The car accident is the traumatic event that is causing intense fear or helplessness in this patient. A grandfather living in Japan worries about his 2 young grandsons who disappeared after a tsunami. This is an example of 1. A situational crisis. 2. A maturational crisis. 3. An adventitious crisis. 4. A developmental crisis. Answer 3. An adventitious crisis. Rational. An adventitious crisis is a type of crisis resulting from a natural disaster, such as a tsunami. During the assessment interview of an older woman experiencing a developmental crisis, the nurse asks which of the following questions? 1. How is this flood affecting your life? 2. Since your husband has died, what have you been doing in the evening when you feel lonely? 3. How is having diabetes affecting your life? 4. I know this must be hard for you. Let me tell you it might help. Answer 2. Since your husband has died, what have you been doing in the evening when you feel lonely? Rational. A developmental crisis occurs as a person moves through life stages, including widowhood. In a natural disaster relief facility, the nurse observes that an elderly man has a recovery plan, while a 25-year-old man is still overwhelmed by the disaster situation. These different reactions to the same situation would be explained best by which of the following? Restorative care 2. Strong financial resources 3. Maturational and socio-cultural factors 4. Immaturity and intelligence factors. Rational, maturational factors and socio-cultural factors can affect people differently depending on their life experiences. An older individual would have more life experiences to draw from and to analyze on why he was successful, whereas a younger individual would have fewer life experiences based on chronological age to analyze for patterns of previous success. Nothing in the scenario implies that either man is in restorative care, has strong financial resources, or is immature or intelligent. You are a nurse working in the college student health center. You receive a call that an athlete has just fallen and has been injured. You know that according to the general adaptation syndrome, the athlete will be exhibiting A. An increased appetite, B. An increased heart rate, C. A decrease in perspiration, D. A decrease in respiratory rate. Answer B. An increased heart rate. The nurse plans care for a 16-year-old male, taking into consideration that stressors experienced most commonly by adolescents include which of the following? 1. Loss of autonomy caused by health problems 2. Physical appearance, family, friends, and school 3. Self-esteem issues, changing family structure 4. Search for identity with peer groups and separating from family. Answer 4. Search for identity with peer groups and separating from family. Rational 1 applies to the older adult. Answer 2 applies to children. Answer 3 applies to preadolescents. A child who has been in a house fire comes to the emergency department with her parents. The child and parents are upset and tearful. During the nurse's first assessment for stress, the nurse says 1. Tell me who I can call to help you. 2. Tell me what bothers you the most about this experience. 3. I'll contact someone who can help get you temporary housing. 4. I'll sit with you until other family members can come help you get settled. Answer 2. Tell me what bothers you the most about this experience. Rational. The patient's appraisal of the crisis is the most important area to address first. When assessing an older adult who is showing symptoms of anxiety, insomnia, anorexia, and mild confusion, one of the first assessments includes which of the following? 1. The amount of family support 2. A 3-day diet recall 3. A thorough physical assessment 4. Threats to safety in her home. Answer 3. A thorough physical assessment. Rational. Physical causes for problems need to be discovered before treatment for psychosocial problems can be initiated. After a healthcare provider has informed a patient that he has colon cancer, the nurse enters the room to find the patient gazing out a window in thought. The nurse's first response is which of the following? 1. Don't be sad. People live with cancer every day. 2. Have you thought about how you are going to tell your family? 3. Would you like for me to sit down with you for a few minutes so you can talk about this? 4. I know another patient whose colon cancer was cured by surgery. Answer. 3. Would you like for me to sit down with you for a few minutes so you can talk about this? Rational. Ask the patient if he would like you to sit down for a few minutes so he can talk. Providing an open-ended question and an opportunity for the patient to talk allows the nurse to assess the patient's perception of the situation, which is of utmost importance. A 34-year-old man who is anxious, tearful, and tired from caring for his 3 young children tells you that he feels depressed and doesn't see how he can go on much longer. Your best response would be which of the following? 1. Are you thinking of suicide? 2. You've been doing a good job raising your children. You can do it. 3. Is there someone who can help you? 4. You have so much to live for. Answer. 1. Are you thinking of suicide? Rational. Although this sounds abrupt, the patient usually is relieved that you've broached this issue. For safety reasons, it is very important to discuss his suicidal thoughts with the patient. The nurse is evaluating the coping success of a patient experiencing stress from being newly diagnosed with multiple sclerosis and psychomotor impairment. The nurse realizes that the patient is coping successfully when the patient says, 1. I'm going to learn to drive a car so I can be more independent. 2. My sister says she feels better when she goes shopping, so I'll go shopping. 3. I've always felt better when I go for a long walk. I'll do that when I get home. 4. I'm going to attend a support group to learn more about multiple sclerosis. Answer. 4. I'm going to attend a support group to learn more about multiple sclerosis. Rational. Support groups often benefit people experiencing stress. A patient newly diagnosed with type 2 diabetes says my blood sugar was just a little high. I don't have diabetes. The nurse responds, 1. Let's talk about something cheerful. 2. Do other members of your family have diabetes? 3. I can tell that you feel stressed to learn that you have diabetes. 4. With silence. Answer. 4. With silence. Rational. The nurse understands that denial is a defense mechanism that assists in coping with the shock. Therapeutic use of silence gives patients time to process their thoughts. A staff nurse is talking with a nursing supervisor about the stress that she feels on the job. The supervising nurse recognizes that 1. Nurses who feel stress usually pass the stress along to their patients. 2. A nurse who feels stress is ineffective as a nurse and should not be working. 3. Nurses who talk about feeling stress are unprofessional and should calm down. 4. Nurses frequently experience stress with the rapid changes in healthcare technology and organizational restructuring. Answer. 4. Nurses frequently experience stress with the rapid changes in healthcare technology and organizational restructuring. Rational. Nurses frequently experience stress with the rapid changes in healthcare technology and organizational restructuring and when a situation seems out of their personal control. A crisis intervention nurse working with a mother whose Down syndrome child has been hospitalized with pneumonia and who has lost her entitlement check while the child is hospitalized can expect the mother to regain stability after how long? 1. After 2 weeks when the child's pneumonia begins to improve. 2. After 6 weeks when she adjusts to the child's respiratory status and reestablishes the entitlement checks. 3. After 1 month when the child goes home and the mother gets help from a food pantry. 4. After 6 months when the child is back in school. Answer. 2. After 6 weeks when she adjusts to the child's respiratory status and reestablishes the entitlement checks. Rational. Generally, A person resolves the crisis and reaches psychological equilibrium in about 6 weeks. A patient comes into the emergency department complaining of chest pain. When discussing possible reasons why the chest pain has occurred, the nurse learns that the patient is depressed because of the loss of a job. This type of crisis can be classified as A. Maturational, B. Situational, C. Socio-cultural, D. Post-traumatic. Answer B. Situational.